Hello there. It is my pleasure to provide you some practical information to help you through your surgical procedure. It is completely normal to feel nervous about the unknown. Together, we will explore how to best prepare, what to expect, as well as the best way to become involved in your recovery of your upcoming surgery. All information presented is recommended and supported by a critical review of the medical literature, including the recent recovery pathway called ERAS, standing for Enhanced Recovery After Surgery. When compared with traditional operative care, using aspects of ERAS has been associated with decreased pain and length of stay, while simultaneously improving patient satisfaction and quality of life, thus enabling you to recover more quickly and resume routine activities in a more timely fashion compared to standard surgical care. Benefits have been reported for patients undergoing head and neck procedures. Please keep in mind that this guide is meant to be a general overview of the type of surgery you may be having. The details and extent of your surgery will depend on the type of cancer or lesion that you have and its specific location and size. Planning ahead of your procedure and going in as healthy as you can will have a positive influence on your procedure and recovery. Pre-operation information and preparation can reduce fear, fatigue, and pain while speeding up the recovery process. Like a marathon, a surgery is something that is best approached when one is prepared and takes the appropriate measures to recover from such a physically and mentally draining day. You should spend the time before the procedure being as active as you can, whether that involves going for short walks or exercising, eating right, and getting a good night's sleep. If you smoke or drink alcohol, you'd benefit to stop as soon as possible, because smoking can cause problems with breathing in recovery from surgery, and stopping alcohol consumption reduces post-operative complication rates. Based on ERAS, and to be confirmed by your healthcare team, the recommended pathway for surgery typically allows eating solid foods up to 6 hours prior to surgery, clear liquids up to 3 hours prior, and encourages preoperative carbohydrate loading, a strategy used by marathon runners to maximize the storage of energy in their muscles and liver. You can drink clear liquids such as water, black tea, black coffee, or apple juice up to 3 hours leading to surgery, but no liquids such as milk or orange juice are allowed. To improve recovery, as your last drink, some physicians will recommend to have an energy drink 3 hours prior to surgery, as this is correlated with improved recovery. Before surgery, patients should shower or bathe, full body, with 4% chlorhexidine gluconate soap at least the night before, and ideally also the morning of, the operative day, as it has been associated with a lower risk of surgical site infection for patients undergoing surgical procedures. Hair in the operative field should be clipped, not shaved, while skin is cleaned to avoid any cuts or irritation. The day of surgery. Try to bring a family member, friend, or someone to assist you. You won't be allowed to drive after outpatient surgery, or even after a few days in the hospital, primarily if you're taking pain medication. Plan to have someone take you home. Wear comfortable clothing. Wear or bring loose-fitting clothing. Your body might be sore or swollen from surgery, or you may have bulky bandages over your incisions. Leave jewelry and valuables at home. Bring toothpaste, a toothbrush, pajamas, denture cup if necessary, and any medications that you take regularly in a labeled pharmacy container approved by your healthcare provider. You may also choose to bring compression stockings to wear on your journey home. On the day of the surgery, the healthcare provider who will admit you will likely check your temperature, blood pressure, pulse, and breathing, review your medication, and help you get ready. You will receive some medication before and after surgery to improve pain control. Frequently, an intravenous tube, called an IV, will be placed into a vein in your arm to allow you to get fluids and medication. When you're ready, someone will help you onto a stretcher and take you to the holding area, and then to the operating room.
During your hospital stay, post-operative ERAS elements typically focus on pain management, bowel function, diet, and patient mobilization. Criteria for discharge for any patient undergoing head and neck surgery include airway safety, tolerance of their diet, ambulation, ability to go to the bathroom, and appropriate pain control. Airway and breathing. During the operation, the larynx, or the voice box, will be removed, which means that there will no longer be a connection between the airway and the nose and mouth. Instead, a stoma is created which connects the airway to the base of the neck, which is a permanent hole that allows for easy breathing. From this point on, you'll breathe, cough, and sneeze through the stoma. You will wear a special tube over the stoma opening called a laryngectomy tube, which will help keep it open and clean. A special button can be placed over the tube to allow for optimal humidification and filtering of the air. It is important to do deep breathing exercises and practice coughing through the stoma. Your nurse will help you with your stoma care throughout your hospital stay. Speech. As your voice box will be removed, your speech will be significantly affected after the surgery. There are many alternative ways to communicate after a laryngectomy surgery, including writing down any questions or concerns you may have. If you've had a TEP, which stands for transesophageal puncture, and a prosthesis was placed during the surgery, you'll eventually start learning how to produce sounds and vocalize in a new way. This will take practice and will be done by pushing the air out through your esophagus and into your mouth in order to start speaking again. There are also electronic devices that may help produce sounds externally. Your speech-language pathologist will work with you closely in order to find the best option for you. They will be working with you immediately after the surgery and for the next couple of years in order to optimize communication strategies and help you with your speech by various techniques and exercises. Swallowing. Until the surgical site inside the throat heals, you will not be allowed to start eating or drinking. Feeding will begin through a nasogastric tube which runs through your nose to the stomach. This is ideally started within 12 to 24 hours after your surgery, as early feeding has shown to reduce certain complication rates. You'll be assessed by a speech-language pathologist who will help decide when it is safe to start drinking water and slowly progress your diet using safe textures and swallowing exercises. It is possible that your surgery will cause a prolonged phase of inability to swallow, in which case a percutaneous endoscopic gastrostomy tube, or a PEG tube, will be inserted from your abdomen to your stomach to allow feeds to bypass the upper gastrointestinal tract. It is possible you are discharged home with this tube until you can resume eating again. It is also important to note that your sense of taste and smell may change after the surgery. As you will no longer be breathing through your nose, you may not be able to smell certain foods, which may alter the way that they taste. Flaps. If the area removed from the surgery is quite large, you may require a free flap in order to reconstruct the area where the tumor was removed. A free flap is an area of tissue that is removed with its blood supply from one part of the body and moved to the head and neck area to help reconstruct the defect left from the cancer resection. The type of flap used is dependent on the types of tissues necessary for reconstruction and is commonly taken from the forearm, called a radial forearm free flap. However, many other types of flaps exist and will be discussed with you in more detail by your surgeon prior to your operation. It is important to note that your flap will need to be closely monitored for up to 10 days, and the donor site will require different types of immobilizations or splints in order to heal properly.
Mobilization. The medical staff may help you out of bed after your operation. You should try to spend up to 2 hours out of bed on the day after your operation. If you feel faint or dizzy, call the nurse to help you get back to bed. On each day after your surgery, it is advised that, provided you feel well enough, you sit in the chair for a total of 6 hours, with intermittent rests on the bed as needed. Your medical team will place compression stockings and give you medication in order to decrease the chance of blood clots in your legs while you're in bed. You should also aim to do some lower extremity exercises, such as bending your knees, rotating your ankles, and pointing your feet up and down. Once you are capable, you should aim to walk along the ward corridor as much as possible. If you need assistance mobilizing, a physiotherapist will undertake exercises with you in order to get back to your baseline mobility. Being in an upright position, getting out of bed, and walking will help improve breathing, increase muscle strength, and decrease the chance of clots in your chest and legs. It is important to note that if a flap is taken from your thigh or your leg, there will be certain restrictions before you can start walking again. Sutures and clips. Incisions on the head and neck are typically closed with sutures or clips. If they are non-resorbable, they will be removed by your doctor or nurse between post-operative day 10 to 14, unless they are on the face, in which case they may be removed after 5 to 7 days to reduce scar formation. All incisions and sutures are strategically placed to minimize scars, and incisions are made inside the oral cavity rather than skin whenever possible. You may help further reduce scars by placing polysporin or vitamin E ointment and massaging the incision 3 to 4 times a day after the sutures and clips have been removed. It is important to avoid sunlight and tanning for several weeks to months after your surgery, as UV rays during the healing process can make the scar more permanent and noticeable.
Mood. Any major surgery is a shock to the system, and undergoing a laryngectomy may require some psychological adjustment to your new self. You may experience a range of emotions, including sadness, anger, despair, grief, and frustration. These are very common and need not be ignored. As you learn to come to terms with your change in speech, eating, and stoma, these feelings will lessen over time. Please talk about these feelings with your nurse, a friend, or someone in your family. If you feel overwhelmed by these feelings or they do not lessen over time, please get help from a healthcare provider. Post-hospital recovery. Soreness and pain. It is not unusual to suffer pains around your surgical sites during the first week following surgery. These pains should be resolved by the time you leave the hospital. If you have severe pain or have a fever at home and feel generally unwell within the first month of your operation date, you should immediately contact a healthcare provider. Your wound. It is not unusual for your wounds to be slightly red and uncomfortable during the first 1 or 2 weeks, but should be well healed by the time you leave the hospital. You may start to take showers at home, but it is important not to get any water into your stoma. Please contact a healthcare provider if your stoma becomes inflamed, painful, swollen, or start to discharge fluid. Diet. It is possible that you are still using the PEG tube for feeds or supplements by the time you leave the hospital. You'll receive a specific diet plan by your nutritionist and/or your speech-language pathologist before discharge. You may need to stick to certain textures or consistencies for a while before your follow-up appointment. A balanced, varied diet is recommended. You may find that some foods upset you and cause loose bowel motions. If that is the case, you should avoid those foods for the first few weeks following your surgery. If you're finding it difficult to eat, it is still important to obtain an adequate amount of protein to help your body heal. If you're suffering from diarrhea, it is important to replace the fluid loss and to drink extra fluids.
Exercise. Walking is usually encouraged starting the day following your operation. You should plan to undertake regular exercise several times a day and gradually increase this during the 4 weeks following your operation until you're back to your normal level of activity. The main restrictions on exercise is usually not to undertake heavy lifting, generally no more than 5 to 10 pounds, and avoid contact sports until 6 weeks following your surgery. In addition, if you're planning to restart a routine exercise such as jogging or swimming, you should usually wait until at least 2 weeks after your discharge from hospital and start gradually. Common sense will guide your exercise and rehabilitation. In general, if the wound is still uncomfortable, modify your exercise. Once the wounds have completely healed, you can normally undertake most activities. Driving. You should not drive until you're confident that you can drive safely. Usually this will be within 2 to 4 weeks of surgery. It is important that any pain has resolved sufficiently, that you're able to completely mobilize your neck in order to look behind you in both directions, and that you are not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. It enables you to maintain your activity and will benefit your recovery. You should not need to restrict these unless they are causing significant pain or involve heavy lifting. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed, but to get out of bed each day and get dressed if possible. In conclusion, to enhance your recovery, you will benefit to return gradually to normal as quickly as possible. This means that you need to actively participate in your recovery by walking, eating, and drinking. Each day you should feel some improvement, but do ask your healthcare provider if you're worried about something. You can refer to the list of products on precare.ca to aid in your surgical preparation and recovery. It is our hope that this video makes you feel more confident about what's ahead. On behalf of the Precare team, we wish you the best on your journey.